Hi everyone, this is Celeste from Foster Club. We are going to give people another couple minutes to join. So in 2 minutes, we'll come back and we'll start the webinar. Hello everyone, this is Celeste from Foster Club and we're ready to get started. Welcome to our webinar, the Healthcare FFY webinar on the issue Youth Who Relocate to Another State. Pleased to have you on. What I'd like to do is give a quick orientation about how to use GoToWebinar. For those of you that are not familiar, there is a chat button at the bottom of this. There's a little control panel, and you can actually chat and send messages to us. You can also ask questions if you would like us to call on. We have all attendees on mute just to reduce background noise for this webinar. To get us started, what I'd like to do is have folks that are on the line go ahead and enter your state, organization, and your role in the chat box so that we can get a little bit more familiar with who's on the line. Hello, Nicholas and Jeremy. Glad to have you. And others can go ahead and continue to add names and where you're from in the chat box. We appreciate knowing who's on the line. Very briefly, our agenda is this. I will kick us off by giving a quick overview of the issue that we'll be talking about today. Then we'll have Jennifer Polk-Hefner talk about the advocate's perspective. Jessica Haspel will give us the state perspective. Then Kristen Torres will provide us with a policy perspective. And we will wrap up with Brian Morgantini, who will give us a young person's perspective. At the end of the webinar, we will have some time for Q&A. We have some folks on the line who really know their stuff when it comes to this relocator issue. So I encourage you to ask questions. Again, you can add questions to the same chat box that you've been providing your name and state in. So let's do a brief overview of this issue, which we've sort of nicknamed the relocator issue. Right now, a young person who relocates from the state where they aged out of foster care to another state, and whether they relocate to attend college or live with relatives or to seek a job opportunity or for any other reason, the young person runs the risk of losing eligibility for health care under the Affordable Care Act's former foster youth provision. Now, one thing that we know is that the original drafters of this legislation under the Affordable Care Act intended to cover all foster youth who age out of foster care. And this sort of came up as a glitch, and we'll hear a little bit more of that from Jennifer. Due to several factors, currently only 9 states are covering young people who relocate into their state, and that's for a variety of reasons. And again, we'll hear more about that on this webinar. What we also know is that this glitch is causing a lot of confusion and difficulties for young people, particularly those, because we know that young people are a mobile group, and many of them are caught off guard when they lose their health insurance when they relocate to another state. And we'll hear more about that from Brian later in the webinar. Our campaign, the Healthcare FFY campaign, the goal is to provide clarity to state stakeholders in improving implementation of the ACA former foster youth provision. And we know that this relocator issue has been a confusing one for many state stakeholders and confusing for young people themselves. And so we hope that the information on this webinar provides some clarity around this issue and provide you with some guidance about how you can move forward, whatever your role might be. What I would tell you is in your control panel, there should be a spot that says handouts, and you can actually download the handout that we've prepared on this issue, and that provides even more details. I'm going to turn it over to Jennifer Hefner from Juvenile Law Center to provide you with more information about the relocator problem. Jenny?
Great. Thanks so much, Celeste. Thanks everyone for joining today. We are really excited to have you participating again in these series of webinars. And this is a really interesting issue, and it does have a little bit of history that's helpful in understanding kind of where we are and the advocacy we hope you'll join us in doing to make sure all young people are covered until age 26. Next slide. Thanks. So to give you this little history of how we got to where we are, I want to bring you back to before even the Affordable Care Act was enacted, and that there was this realization that transition age youth are really at risk just across the board, not just those aging out of foster care, but that population is really at risk of being uninsured for a lot of different reasons. Young people don't yet have the kinds of jobs that necessarily provide the insurance coverage that many of us take for granted, and they don't necessarily have the income yet to purchase the policies that would be most helpful to them. And young people also don't necessarily prioritize health insurance, particularly as they're entering adulthood and have so many other things to worry about and really getting a foothold kind of in the adult world. So all young people at that transition age are very much at risk of being uninsured, and obviously that has significant consequences. The other thing we know, and again, all of you on the call are well aware of this, having access to health care and care is so vital to a successful transition to adulthood. And again, that is something that lawmakers as well as all of us really did understand. And then we also did know at that time and continue to know that youth who age out of foster care not only are at risk of not having insurance like their peers who aren't in care, but also might have are at higher risk for having high health care needs. Making both health insurance and access to high quality care so vital to making a successful transition to adulthood. Next slide. So the Affordable Care Act was so essential because it really did take all those things seriously that I just mentioned. It said that it is really vital. We want to make sure that transition age youth have access to health insurance and health care. And the law developed some really powerful and important provisions to make that possible. And the two key provisions that address transition age youth was the first, which is very popular and continues to be, that allows young people who are raised in families to stay on their parents' health insurance until age 26. And young people are allowed to do that regardless of where they move, whether they go to college or move away. That's an option they have, and that was very wise of lawmakers to put into the Affordable Care Act. And the second provision was the former foster youth category of eligibility. Next slide. And the former the former foster youth provision amended the Medicaid statute and added a categorical eligibility category. And we have all the words on the slide for you. You don't have to memorize them, but we wanted to make sure we just gave you kind of this is what that new category looked like. And it really does ensure that youth who were in foster care at age 18 or older, if the state has extended foster care and were enrolled in Medicaid at that time are categorically eligible for Medicaid until age 26. And again, such a vital provision that really was supposed to make sure all young people who aged out did have access to this coverage, that it was streamlined, it wasn't dependent on income. And so this was that second piece of the Affordable Care Act, really addressing the needs of transition age youth. Next slide. So very soon after the enactment of the law, there was confusion and questions about how states were to approach the coverage of youth who were in foster care in other states. So the question arose, were states mandated to cover youth who were in foster care in another state? So for example, is Pennsylvania obligated, mandated under federal law to cover a youth who was in foster care in Ohio? And so there was confusion around that and questions that were put to the Center for Medicaid, and they did start to issue some guidance. So we wanted to give you a little bit of what that history looks like. So CMS did a notice of proposed rulemaking in January of 2013, and at that time they were proposing the interpretation that states had the option to cover youth who were in foster care in other states. So that would mean that they had the option to cover youth who were relocating to their states, and they were proposing that the way states would do that would be by amending their Medicaid plan, which of course takes time to do, but is a process that states are very familiar with, and was a way that was fairly simple, that states could opt into this option to cover youth from out of state. And so on the slides you have the list of the states that did amend their Medicaid plans to cover youth from out of state. So at that time, January 2013, this was the proposal, and states were responding to kind of the status of the interpretation, and so amending their Medicaid plans. But then we get to 2016. Next slide, please. And in the end of November in 2016, CMS did issue their final rule. And their final rule really told the states what their interpretation of the federal law was. And so their final interpretation of the federal law was that as they read the Affordable Care Act, they were saying states were not mandated to cover youth who relocate, that states did not have the option to cover youth by amending their Medicaid state plan, but they could opt to cover youth from out of state, so cover youth who relocate through Medicaid Section 1115 demonstration waivers. Next slide. And so this slide, again, we just wanted to provide you the authority so you'd have it to reference if you needed to. This is the regulation that was the result of that final rule, and really does tell states how they have to handle at this point if they do want to cover young people who relocate. So they do need to apply for this Section 1115 waiver, and if you do go to the issue brief that Celeste mentioned earlier, it gives you links to some of the CMS publications and guidances that explain to states how you apply for that waiver, and also gives states information about what are the requirements of doing a demonstration waiver in terms of things like reporting. Next slide. And so at the time that we're doing this webinar, about 9 states have been approved for Section 1115 waiver. So this means these are the states that we have listed on the slide that are covering youth who relocate to their states. New Mexico's waiver is pending. And at this time, states can apply for Section 1115 waivers at any time. So we are going to be encouraging you all, if you're not in one of the states listed on these slides, to advocate that your state apply for a waiver, and you will be able to tell them that they can do that tomorrow if they're ready, and that is something that is an option that they can take advantage of as soon as possible. So this gets us to where we are today, and obviously puts us, helps describe what the problem is, which is the problem is the way the feds are currently interpreting the Affordable Care Act is that states are not mandated to cover youth. So this does mean we have a large number of states that aren't obligated and aren't electing to cover youth from other states, which means when young people move out of the state which they were in foster care in, they have some risks to be uninsured. We'll talk about other ways they will and should opportunities for health insurance, but in terms of having this benefit of categorical eligibility under the Medicaid statute, that's not a guarantee for them, given the federal interpretation. So we want to provide you, after looking at California, hearing about the status of the federal activity in terms of reform, give you some tips on, advocacy you can do in your state, but also some thoughts about working with individual young people. Now that you do know that they may be at risk for not having this coverage, how do you ensure that they're covered? What other insurance types would you be looking for, and how might you do some advocacy through their transition plan? But with that, I'm going to turn it over to Jessica, who has been one of the prime advocates with many of our great advocates in California to make sure that California is one of the states that did 1115 waiver, and that they've really implemented some of the policies with that waiver to both deal with youth in state, but also coming in and relocating to serve as a real great model for a lot of us across the country.
Thanks, Jenny. Actually, can you advance the slide? I'm going to talk a little bit about sort of the history of California covering former foster youth from another state, and then I'll talk a little bit about how it actually works. So actually going back way before the Affordable Care Act took effect, there was an earlier option to cover youth who aged out of foster care up to age 21, and that was an option that states had called the Chafee option. And back in 2000, California took up the option to cover youth who had aged out of foster care, so from the age of 18 up to 21, for youth that weren't participating in extended foster care or didn't have the option of extended foster care. And so in California, with our implementation of the Chafee option, we were covering youth who were 18 to 21 and had left foster care at age 18 or older, and we were doing so regardless of what state the youth had been in foster care in. So we essentially were covering relocators in that 18 to 21-year-old category before the Affordable Care Act. And my understanding is at least 30 states have taken up, prior to the ACA, the Chafee option to cover former foster youth in the 18 to 21-year-old range, and I believe certainly other states besides California had opted to cover relocators under that category. So when it came time for us to put in place implementing statute to take up to put into state law the Affordable Care Act former foster youth provision, it was a natural progression that we would continue to cover the youth that were relocating up to age 26, in keeping with the policy that we already had to cover them up to 21. In California, we generally do implementing statute. We put into our own state statute any new federal requirements. So we codified the Affordable Care Act former foster youth provision into our state law prior to it taking effect in January 2014. And at the time that we did that, we included language directing the state to take up the federal option to cover relocators. And then we followed up after that was in state law, and the state did pursue an approved state plan amendment to cover youth who were from another state. So from day one of our implementation of the former foster youth provision under the ACA, we were choosing to cover youth regardless of what state they were in foster care. Then when, as Jenny mentioned, there was the change in course where CMS indicated that states needed to pursue an 1115 waiver in order to cover former foster youth from another state. And so we worked to ensure that we pursued that waiver so that we could continue covering the former foster youth that were moving into California but had been in foster care in another state. Next slide. So one of the things that I think is really important, and that there was a lot of advocacy around when it comes to the former foster youth coverage for both in-state and out-of-state youth, was to make sure that we were treating both groups equally. For those youth that had aged out of foster care in California, we had two cohorts of youth. We had the youth that were leaving care after the Affordable Care Act took effect, and for them, their transition into the former foster youth program was automatic, and they didn't need to apply. But for the youth that were eligible for the provision and had aged out before the law took effect, they did need to apply. And we wanted to make sure that for those youth that were from California and had to apply, and for the youth that were relocating from another state, that we were having similar enrollment processes. And the way things work in California is that if a youth needs to apply because they don't fall into that group that is eligible for the automatic transition into the program, they can apply either using a short one-page form that they can submit to the county that they're living in. It's specific to former foster youth, so it only includes some very basic questions that are relevant to eligibility in the former foster youth program, or they can apply using our online system, which is the full Medicaid application, but we have programmed our state system so that once someone answers that they were in foster care at age 18 or older, it will allow them to skip the vast majority of the application that's not relevant to their eligibility, like questions about tax and income. So for both youth that were in care in foster care in California and those that aged out of foster care in another state, they can use either of those application avenues and get the same result, that they are immediately enrolled in coverage based on saying yes, they were in foster care at age 18 or older. Both applications also have an additional question that asks where the youth was in foster care. The reason that is important is it helps in then being able to do the verification of former foster youth status in order to verify their eligibility for that program. And again, the youth are enrolled based on the self-attestation, so there isn't a delay in coverage starting. And county eligibility workers on the back end will look for the information they need to verify the eligibility for the former foster youth program. And the youth themselves are not to be asked for any written proof or documentation unless the worker is unable to verify the information on their own. So for example, a county eligibility worker that knows that a youth aged out of foster care in Alaska would be able to contact Alaska to ask for the information they need to verify the eligibility, and they would only ask the young adult to provide documentation if they were unable to get that information on their own. Again, as I mentioned earlier, because this was something that was already in place for the 18 to 21-year-olds prior to the Affordable Care Act, this wasn't something that was totally new or unfamiliar in terms of verifying eligibility. And in order to help in the process to do so, counties were given a list of the independent living program managers in other states that could be points of contact to help them in tracking down the information they would need to know. And since we do treat both populations the same, all eligible former foster youth are enrolled in the same aid code. They're treated similarly in every way. And again, we felt that was really critical in terms of ensuring parity, and that was not more burden on the youth just because they chose to relocate to another state for whatever reason it was that they were, needing to relocate, whether it was for school, for, to be closer to a support system, for a job. And what we've heard from the individuals responsible for doing the eligibility checks, they have not found it to be something that they're saying is burdensome for them to do. I think one of the other things I just wanted to say with regard to the verification process is it's important to keep it as simple as possible for the youth, because with their moves and whatnot, it can often be difficult for them to actually produce the documentation that might be needed, and sometimes they don't know exactly what type of document or what information would suffice. So the process that allows the eligibility workers to do the check first and or assist the youth in getting the information they need if they can't determine what they need on their own, is really critical to ensure that there's access to the program. With that, I'm going to turn it over to Kristen Torres to give a policy update on some efforts to fix this issue on a national basis.
Great, thank you, Jessica. I feel really honored to kind of be on this panel with advocates like Jenny Hefner, Jessica Haspel, and Foster Club. I am probably the least knowledgeable of this subject area, but I have had the opportunity to work on the federal level with some of this legislation for the last year and a half. And I'm really excited to say that there's a little bit of movement. While I think there can always be improvement, and while we have some suggestions for how it can be better, I'm really excited that this piece of legislation is kind of up front. On the House side, HR 4998 was introduced by Representative Karen Bass, the Health Insurance for Former Foster Youth Act. The companion is on the Senate, S1797, and that is from Senator Bob Casey's office. And this is not new. This has been happening, and many of the advocates on this call and on this panel have been working on this issue for a few years now. So I'm really excited that I get to kind of be a part of this. But the bill works to address the issue that we've been talking about of how states have been given the choice to cover youth that relocate from another state. And while there are some states that are doing this well, we want to make sure that this is a national coverage, that youth are able to be covered regardless of where they go. And so this bill last year, and as I mentioned, some of the advocates here on the phone today, you guys were very instrumental in working with Senator Casey's office to kind of add a few provisions, kind of making it more robust. And so I'm very excited about that. But recently the bill was added to a package in the House it was called the HR 6 Support for Patients and Communities Act, and this is a package of bills that were put together to address the opioid crisis. A few of the advocates on the phone are part of our State Policy and Reform Center, SPARK, which is an initiative of First Focus, and we sent in a letter to the committee just asking that they think about this population when they're thinking about addressing this crisis. We know that they do have higher health needs. They are a vulnerable population, and a population that not always has continuity of coverage. And so we're very excited that they did add this bill to the package. It went through a pretty rigorous test through the Energy and Commerce Committee, and through some back and forth. They had lots of questions. There was some discussion about the cost. So as you know, providing this coverage was CBO said that the score was pretty high, and so that was kind of a difficult conversation to get through with the package. So in order to kind of reduce this cost, they had to kind of pare down what we had as a more robust package bill in Senator Casey's office. They took out the provision that that provided coverage for youth who aged out or left care and went into a kinship provision. There was a piece about outreach and enrollment, providing that guidance through the states and requiring them to have a plan for enrollment. And then they also put a mandated delay for 5 years. So beginning 2023, youth who age out in 2023 will then be covered. States will be mandated then to cover these youth. So while we definitely will continue to advocate for the kinship provision and the outreach and enrollment, right now what the bill is simply just a fix for this option piece. The bill passed unanimously through committee, and it is scheduled to go to the Rules Committee as we speak at 5 o'clock on Eastern Time. So we're not expecting any problems. We are expecting it to go to the floor, and we're really excited about that. On the Senate side, there's not been any movement. The bill does not have bipartisan co-sponsors, so I think there might be some room for folks if if someone is interested in this issue, if we could advocate for that on the Senate side. But I think once it passes the House, there might be some room for conversation there. While again, I think we want to be more robust and we want to continue to push for the provisions that we've added, I am excited to see that it did pass unanimously, that through the committee, that everyone agreed that this was an important population and that they deserve continuity of coverage. So with that, I'm going to pass it over to Brian to give us a foster youth perspective.
Hello, everyone. My name is Brian Morgantini. I'm originally from Pennsylvania. That's where I experienced foster care. I'm a former foster youth. Spent about 14 years in the system. Currently live in Oregon. I wanted to talk a little bit about my personal struggles when it came to obtaining and retaining health insurance, especially as someone who travels, who chases after opportunities, and needs health insurance. So I left Pennsylvania, recently aged out of the foster care system at this point in my life. This was a few years ago. And as I think Jenny mentioned earlier, on the forefront of my mind, I was not thinking of medical insurance at all. I was moving 3,000 miles away to the land I always dreamed of going to. I went to California initially. But when I got there, I reached out to some people that I knew and asked about resources specific to the population of former foster youth, and I was able to go and get health insurance. And the process, as Jessica was mentioning, is very, very easy. It was one page, about a day, and then I was covered. So if anything ever came up, then I was going to be okay. But it actually was too expensive for me to live there, and so I struggled in other ways. But I took an opportunity to get a job up in Oregon. And again, I was not thinking about health insurance at all. But when I arrived in Oregon, I was not able to get coverage based on income. I made a little bit too much. And also because they did not opt in to covering foster youth that are from a different state. And that created some issues for me. It created medical bills and still a concern, as I'm in Oregon still, but a concern that if I ever physically injure myself, how am I going to be able to go to work? Who's going to take care of me? I'm all alone, 3,000 miles away from home. And it really is important for me as a former foster youth, as an advocate, that we make this coverage seamless, because just as a youth who's under their parents' insurance until age 26 can go anywhere for school, college, for employment, whatever it is, that we should be able to do the same thing, because we chase opportunity and deserve the same chances as everyone else. Thank you.
Thanks, Brian. I think that really puts an exclamation point on why this piece is so important. So next, what we want to do is open it up to people who may have questions. Again, you can type questions into the chat box. We'll try to get to a few. If you have questions after the webinar, you can email Shannon at fosterclub.com, and we'll do our best to collect questions. We are available to provide technical support or arrange technical support to those. We have lots of people that are partnering with us on the Healthcare FFY campaign, so we are happy to try to arrange technical assistance for states who want to move things forward for young people. We do have a couple questions already in the queue. So the first one is a question about who applies for the 1115 waiver, and whether that's Congress, Senate, state Medicaid directors. So I'm going to throw that, Jessica, I don't know if you know in California, or Jennifer, perhaps you know for Pennsylvania what the case was.
Hi, this is Jessica. I'm happy to chime in. It's your state Medicaid agency is responsible for applying for the 1115 waiver. At least that's the case in California. So I'm not sure if it might be different in other states, but I believe that might be the case for all states, that's who the responsibility lies with.
Thanks. Anything to add, Jenny?
No, I mean, I agree. It is the Medicaid agency and all the directions that we have. So again, if people want to, we provided the link in the issue paper, so you can go exactly to the place on CMS's website to both see more information about the guidance, about the interpretation, but then links to information on their website about how you actually fill out the form and some tips. And so your advocacy should be directed at your state Medicaid agency, but that's not to say that, definitely seeking the support of your child welfare agency, and they most of the time have relationships with the Medicaid agency. So having their support and contacts and help to reach out to your state Medicaid agency, I think, is important. But I think in the end, it is your state Medicaid agency that has to fill out that application.
So we also have an addition, thanks for the note, Jeremy, that also legislatures typically have the power to order the state Medicaid agency to apply for a waiver. He states that's the case in Missouri, so thank you for that addition. Another question that we have is we have a request to have the bill numbers read again. Kristen, could you read us both the House bill and Senate bill numbers? And then we can also send out to the group. Could you remind us of what those numbers are for the folks that want to watch that legislation?
Yes, in the House, it's HR 4998, and then in the Senate, it's 1797.
Great, thank you.
And I'll just add that the package is HR 6 that has been added to in the House.
So added to HR 6. Okay, very good, thank you. The next question, does the waiver take money out of the state's budget or provide further funding from the federal government? Jessica or Jenny, are either of you able to take that?
So similar to coverage for youth that were in foster care in your own state, it's the same federal drawdown. So each state has a different federal matching rate, so I can't tell you exactly what the matching rate would be. It depends on what state you're in, but for example, in California, our FMAP is 50%. So for any youth that we're covering under the former foster youth provision, whether they're youth that were in foster care in California or youth that were in foster care in another state and have since moved here, the federal government is providing 50% of the cost, and 50% is the responsibility of the state.
Thank you. It looks like for now, those are the extent of our questions. So we'll flip to the next slide. To wrap up, we thought we would provide the group some next steps. And Jenny, I'm going to turn it back over to you to go over some of our recommendations.
Great, thanks. So yeah, I mean, these are a couple of things you all can do and give you some different levels of opportunities for advocacy. So the first is to support that federal bill and help us just show members of Congress that this is really important and that um, we really need to ensure that young people do have this particular coverage and that was the intention of the law. So any advocacy and support you can provide, and I think Kristen, maybe there'll be some alerts to people of ways they can sign on to letters. I know Spark has done a couple of letters, so we'll definitely keep everyone who's on the call and part of this network aware of opportunities to sign on or some advice about talking to your representatives to show your support. And then secondly, advocating, we only have about those 9 states that have 1115 waivers. You can make a huge difference by doing advocacy in your state to get your state to apply. And I think most of the members of the presenters on this call are happy to provide you more advice on how to do that. But I think, the federal interpretation now makes this the way states can really cover those young people. And if someone doesn't make some noise about it, they may not elect to do this. So this is something where I think you can make a big difference in your state by making some noise, doing some flyers, making some calls, and letting your Medicaid agency know that you think this is important and that you're going to provide support as they do their application. And again, I think all of us on the call look forward to giving you support to do that because we want to see the numbers of states who are applying for these waivers grow. We also, in thinking about advocacy at your state level, is go back to some basics. And some of the basics we have just around our Medicaid law is that whenever a young person or any person's Medicaid case is about to be closed, for example, if they move or change some status that impacts their eligibility, the Medicaid agency should look at if they're eligible under other categories. And we just want to raise this to make sure people are aware. We want to make sure young people have this option of the Medicaid to 26 is categorical eligibility, but we do want to make sure youth are covered with health insurance until we have the coverage across the United States in terms of this form of foster care provision. So we do want to make sure people are looking out that if a young person is being closed out in that form of foster youth category, that we are making sure that other categories of Medicaid are being considered, and that we really think about making sure that some of our existing laws around Medicaid are followed, and that would impact youth both within their own states, but also as they relocate. And then our fourth recommendation is again about kind of going to basics in terms of basics of laws that currently exist. We have pretty strong federal law and state law requirements around transition planning for youth as they leave the foster care system. And one of those required components is related to health insurance and meeting health care needs. And I think when advocates pay attention to this obligation and really make sure that both courts and the Child Welfare Agency are paying attention to it, this is one way to help cover some gaps. So, for example, as part of my transition planning obligations and requirements, if I'm the attorney for Brian, I'm making sure he knows that, Brian, you're moving. Okay, which state are you moving? Do they cover young people who relocate? If not, what are your other options and how are we going to make sure you're connected? And that we have to make sure as people working, I'm sorry to use your example, Brian, but it's just an example of like as professionals working with young people, whether we're part of the Child Welfare Agency or we're their attorneys or we're just their mentors or advocates, this transition planning requirements are really strong in the law, but they need to be enforced. They don't just always happen on their own in terms of being implemented exactly to a T in terms of the letter of the law. And so sometimes there is that need for, and we have this opportunity for advocacy. And that leads us, I think, to have these conversations with young people so that they really know their options and they really know the reality. Because as Celeste said, and when you look in the issue paper, you're going to see that a lot of young people call Foster Club and don't even know that you know, they don't know a whole lot about the former foster youth provision, or they heard about it, but no one told them what would happen if they moved to another state. And we want to make it so it doesn't matter if they move to another state, that their coverage is guaranteed. But until that time, we do want to make sure we're providing young people the information and helping them plan, so that if they do indeed move to a state that doesn't cover youth who are relocating, we've really helped them figure out how they would be covered. Does that state have Medicaid expansion? Might you be eligible for that? Do you fit into another Medicaid category? If not, then what are your options for healthcare? So we do want to give you this range of kind of opportunities and for advocacy, because our bottom line goal for this campaign is that all young people are covered, at least until age 26. Until we have this federal fix, we want to make sure that we're really working with our colleagues and with young people to make sure that they do have coverage until we have kind of the across the country guarantee. And I think that we can do that and improve the connection that young people have to health insurance. If we do that transition planning, if we do really pay attention to the Medicaid laws. And I think the last advice I would give is, some of these things for different people on the call might be like overwhelming to be like, wait, you want me to enforce the Medicaid law? And I think what I would say to you is, what we want you to do is recognize some of the things that you need to, that might be red flags, but you can call your colleagues. You can call one of us. You can call some of the guardian ad litems or some of the healthcare law advocates in your state. You don't have to do all of this by yourself, but I think what we want to encourage you to do is really be aware of these issues and be able to connect the young person with the advocate that they need. And again, we really do want to help you do that. So please do reach out to us.
Very good. Thanks, Jenny. I'd like to thank our panel today. Thank you, Jenny. Thank you, Jessica, Kristen, and Brian for participating on the panel. For those on the line that have questions, feel free to follow up with Shannon at fosterclub.com with any questions. We'll also send out a follow-up email to this webinar. And look soon, we'll be launching the Healthcare FFY website, which will house our issue papers and also house information, state-by-state information about healthcare for former foster youth. Thanks again for joining our panel today.